Hello, my name is Megan Wiley, and I'm a physical therapist at Balance Within Integrative Physical Therapy. I love helping people from all walks of life get back to doing what they love to do. I think our bodies have an innate ability to heal, and I love to guide people through that healing journey to not only feel better, but also gain self-confidence and self-awareness to go back to living a life without restrictions. Whether that be maybe more adventurous things like conquering a marathon or going sea kayaking, or maybe it's simple things that we sometimes take for granted, like wanting to be able to pick up your kids or go grocery shopping or sweep the floor without issues. A lot of people come to me who have been frustrated with in the past with dealing with chronic hip or shoulder or knee or pelvic pain sort of conditions. I especially love working with mothers. I have a special place in my heart for working with moms, whether their kids are 4 months old or 40 years old. I think that motherhood is such a special journey, and unfortunately sometimes the needs of the mom get kind of pushed back a little bit, and that might be for a couple months or a couple years. But I think that but it's common for women to hear that there are frustrating things like pelvic pain or leaking that's normal afterwards. And I love to show people that they can get back to doing anything they want to without these restrictions, and that we can beat that. I began out my career as a personal trainer, and while I loved helping my clients work through their fitness goals, I knew I wanted to learn more, and continued my career as a physical therapist and received my doctorate from the University of Wisconsin-Madison. Since then, I've worked in a variety of different orthopedic and sports medicine settings. However, I found after the birth of my third child, I developed my own personal postpartum challenges and discovered my calling of working in the field of women's health as a specialty, and so I could help others who had been through similar things that I had been through. I also have advanced manual skills in the John Barnes myofascial release technique and visceral manipulations, as well as functional manual therapy. I am a pelvic floor therapist and a postpartum corrective exercise specialist, and I have been certified through the Gray Institute for Applied Functional Science. So I'm able to weave together some of the traditional orthopedic background with some of the higher level manual skills, as well as incorporating specialties of pelvic floor and breath work and functional movement analysis to get people not only feeling better, but helping to gain that self-awareness so they can prevent issues down the road. If you've been dealing with any type of pain, whether new or chronic, or any type of pelvic floor concerns like leaking or prolapse, abdominal separation, or pelvic pain, I would love to talk with you and answer any questions you might have. Or if you're a new mom and you're looking for guidance on how to get back into exercise safely, I would love to chat about that as well. No one should be limited by fear or pain from doing what they want to in life, and I would love to be able to help you out with that.